The number of COVID cases in the country is on the rise.
We're seeing just an increase of cases everywhere. It's global. So those cases are being seen again on the rise. As a matter of fact, COVID never left us. I mean, COVID has been here, and I believe it will be here to stay. It's just that we are having these numbers, and of course, those that are testing is not, let's say, adequate enough because people are still not testing enough. We're not doing that testing, so it's severely underreported at this time.
Which means that the number might be higher than it is on paper. Director of the Epidemiology Unit in the Ministry of Health and Wellness, Dr. Russell Manzanero, told News 5 that for the past 4 weeks, the ministry has been recording a slight increase in cases. He says that the Belize District is recording the highest number of COVID cases.
We do have, of course, based on population size, of course, we're talking about Belize District. I mean, we have a lot of mobility in the Belize District, and by Belize District, I'm referring even to the Keys. So a lot of interaction, a lot of movement there. So when we're talking about these movement of individuals, all of that, the tourism sector it's booming. So we do have a lot of interaction with a lot of people. I'm not saying the tourists per se, but I'm just saying that there's a lot of involvement, interaction between individuals. Whenever that happens, you see an increase of cases of respiratory illnesses. And by that, I also mean COVID.
According to Dr. Manzanero, there has not been a severe COVID case or a COVID-related death recently. Cases have been moderate, with most being among the vulnerable population.
We have had few admissions for COVID. Still, there are moderate cases, which means that they're on high flow oxygen. Nobody ventilated, nobody like that. And the people we're seeing basically, again, is in our high risk group. So over the past days, perhaps we're seeing an increase of cases in the elderly population. So we still have to take care of our elderly population. You know, when you go visit your grandparents or your mother, your father, you still have to take those things into consideration. So if you have only flu or anything like that, make sure you use a mask if you know they're ill. But that I mean, if your mom or your grandmother is a diabetic or have cancer or anything like that, you take your measures and you protect them too. So you have to wear the mask as well. What we have seen in the past, I believe for a month now. So for the 4 weeks now, we've been seeing like a slight increase in cases, not significantly to say, okay, we have one outbreak or so. It's more so these cases are starting to pop up once more. Similarly, we're seeing other cases of flu viruses. So even though we have COVID, we also have influenza, we have RSV. So all of those other viruses are also circulating.
Should the public be concerned?
Measures won't be the same. I mean, the vaccinations happen, it's still there. You can still get vaccinated for both of them. But generally, at this time, the concern is, of course, still with at-risk groups. You know, we have our elderly patients, we have our pregnant mothers, we have our children, or, you know, all those same ones that we've been saying. However, I believe everybody has to still do their part. With that, I mean, it's the hygiene, hand hygiene, make sure the cough etiquette is being done. Cover your nose, cover your mouth, sneeze in your elbows. Try to keep your hands clean, wash them regularly. That still is key to a lot of our processes for respiratory and gastro problems that we're seeing.
Britney Gordon for News 5.